Okay, guys, sorry about that. I had to end the class because of bad weather. Today is Friday. You never know, when it starts like that, you could end up flooded. And I said, let me just be like Molly Muhammad. Despite anything, we just carry on. Okay, so let's carry on from where we left off. We're still on mental health and illness, the introductory bits. So right here we have a picture of a student who's having various challenges. She's stressed with her studies. Her phone is stressing her. She also has bills. And as a result, this student has become withdrawn. She experiences sleep disturbance and she performs poorly in class. So you can please just comment in the chat. How would you intervene as a social worker to assist this particular student? Okay. And so we just want to look at how we can apply the biopsychosocial model to different mental disorders. And remember, like we said, we are just connecting to the previous class. This is the model that we are absorbing for use because it covers various aspects, and so it ensures sustainability of the intervention results. Okay, because we cover the biological factors that affect the person who is the mentally challenged person, the psychological factors, and the social factors. Okay, so let's look at, for example, look at one example. Let's look at schizophrenia. And in this case, if you're, we have a client in mind who has a genetic predisposition to schizophrenia. So previous, maybe their parents or their grandparents or other relatives who they share a bloodline with had schizophrenia. So they have a genetic predisposition to schizophrenia. Another biological factor that would influence somebody having schizophrenia would be brain structure abnormalities, which could take place at birth or while growing up from an accident and similar activities. So when in our assessment, we would look at biological factors that would cause or would predispose that particular client to schizophrenia. And then we look at the psychological factors. Okay, so for example, the symptoms that they would be presenting, like hallucinations, those are psychological. Poor insight and others. And then we'll also look at the social factors that actually can be pushed or exacerbate the condition, okay, or trigger the condition. For example, being isolated, okay, so not having a lot of contact with, let's say, family or people who can stimulate them, stigma from society, okay. So we'll then be able to explain the cause of the illness from each and every one of those three factors. So in summary, was saying that mental illness, when you're looking at mental illness, you look at its interaction in terms of the three domains. And this helps us to assess mental illness holistically. All right. So I'll just request you to just, in brief, from what we've been capturing on the biopsychosocial model, you can just write three words that uh, help you to summarize your understanding of this model. Okay. We'll then move on to the next lesson, which is lecture 3. And in this particular class, we are going to apply these theories or this particular theory to real Kenyan cases. So it's very important that now we begin to apply and not just take on theory. So this is important because theory without practice is not valuable. It's useless, really, for us, especially for us who want to cause change and influence communities positively, individuals, groups, and communities positively, the society as a whole. So we must solve real problems as social workers. So I've put forth a case here. Case number 1, a Kakamega border rider. This person is experiencing stress, police harassment, and family pressure. And so from this, I would like you to be able to identify the biological domain, the psychological domain, and the social domain. And then you can just put your response in the chat. Okay. All right. Then I have another case too here. It's a case of suicide. We have this young man here. I'll put up a picture here. Who has experienced failure in his exams in the last KCSE exam, and is also going through lack of support, even after emotional support, even after that experience. This, of course, was a major trend in the country in the past, prior to changing the education system to be more competency-based. And so, yeah, we're looking at this example from our past experiences. So, based on this suicide case, I would like you to just please go into the comments and type your suggestion for interventions that can be used to assist this young man. And then in your groups, your class discussion groups, please design a simple intervention plan together, again, for this particular case. All right. So in brief, real cases require holistic thinking. Okay. We are back to the biopsychosocial model. And then we must combine theory and action. Okay. Okay. Let's move on to the classification of mental illness. That's what we're going to learn next. And this is important because it will help us to be able to diagnose mental illness, to refer those who are affected to the right professionals where necessary, and to influence policy. Because when you're influencing policy, we have to be clear about what we want to address. So, mental disorders are classified systematically, okay, grouped together to aid in diagnosis, in treatment, in research, and in policy. And globally, 2 major classification systems exist. We have the DSM-5, and then we have the ICD-11, the International Classification of Diseases, the 11th revision by WHO. The DSM-5 is by the American Psychiatric Association. Okay, we have had various DSMs, and as they upgrade, they change in number. So for now, we are using the DSM-5. So it's important for us to understand these classification systems so that we can easily work with other professionals in the discipline, okay? So that when we diagnose, we understand each other, or when they diagnose, then we understand them, right? In Kenya, particularly, the ICD is usually preferred and used in public hospitals And the DSM is usually preferred and used in NGOs and the private sector. So I just put for you a comparison table here, where I've also noted that the DSM-5 is usually paid for, and the ICD-11 is usually available for free by the organizations that use it. This is just a picture for reflection of a mental hospital. And I pose the question here: what are the dangers of labeling somebody mentally ill? Okay, you can just think about that and put your comments in the comment section. So one of the realities, or some of the realities we have in our country in terms of service provision or addressing mental illness matters is includes stigma from the community, the cultural perceptions about mental illness, the cultural beliefs that as opposed to being treatable by medication or being caused by biopsychosocial factors, or biopsychological factors, that some of the causes could be attributed, let's say, to witchcraft, okay, and other factors. So somebody who is affected would then be stigmatized in the particular society, because they would be viewed as somebody who attracted a curse, right? We lack enough professionals to be able to address the mental health challenges that we are facing in the country. That's one reality we are facing in the country today. The cultural misinterpretation, like I already alluded to, about mental illness. Okay, so I would like you to also, in your groups, just please discuss this, some of the other challenges that we experience in terms of addressing mental illness in our country. Okay, and then just type one additional thing that you have learned today. We then move on to the next aspect of this class, the next content. And in this content, we are going to move beyond just looking at theory and explore how we can use mental health knowledge to actually earn income, to build our careers, and to create impact in our country and beyond that. Like I always emphasize, okay, knowledge is great to have, but it is important that that knowledge is also able to translate to economics. Okay, it can be able to assist you move higher or develop in your career. It can assist you earn additional money. Okay, it can grow your networks. Okay, so it's just not having knowledge for the sake of having knowledge, so that you don't just have this course in your transcript, mental health and illness, and it's not adding financial value to you. So, I always like to add these bits into the content so that the content is practically relevant for putting food on the table. Okay. So please just type in the comments, what would you prefer, like, to use this knowledge for? Would you like to use it for self-employment, or to gain new employment, or to get promotion in your current employment? So which one are you interested in? And then it will also give me a guide as we go through the content on what kind of focus to keep giving the content. Okay. So like I said earlier, yes, we do have insufficient mental health professionals, particularly because of the increase in the mental health challenges. Okay, there are various mental health challenges that we have already talked about. So there's a high demand for youth to deal with youth mental health crisis. We have a very vibrant, youthful population in our country. They really stand out worldwide, globally. Some of the impacts they have made have put them on the map globally. But then they also face challenges in accessing employment, accessing activities that can engage them. And so because of that and other reasons, they do face a lot of mental health challenges. So we have a crisis looming that needs to be addressed and fewer professionals to address that. There's also a high demand to deal with substance abuse matters. There's an increase in the uptake of legal and illegal substances, and a heightened increase in workplace stress, leading to people being violent at various workplaces, being corrupt, and being engaged in practices that clearly show that there is an imbalance in their mental health. So the truth is that those who position themselves in this mental health arena are likely to secure several opportunities, or economic opportunities particularly, and more so opportunities to contribute to a mentally healthier society, okay? To have that mark to bring about positive change, which is very fulfilling. So you can also just comment and write the 3 mental health problems that you see people around you struggling with. What are the 3 mental health problems that you commonly see people around you struggling with? Okay. So let's dive into some of the work that you can actually do. I've started off with self-employment and consultancy so that you can begin to dive into that as early as this. um, like I've always encouraged you, you can register your consultancy as an individual, or even work together as in teams, and begin to do this work so that you already will have the experience that will take you through it for a long time. So you'll be already using the time you have to acquire more and more experience. So in self-employment and consultancy, you can be providing counseling and psychosocial support services. A lot of people in workplaces and in various organizations will look at them, or institutions really need psychosocial support. Okay, so you can actually provide that and charge for it. I've just put a picture there on that. So you can offer individual counseling and just focus on that. You can also offer family therapy. You can focus on family therapy. You can focus on trauma counseling, or you can do all of these and more. And you can link up with churches to provide these. You can link up with schools, community centers, workplaces, various institutions, organizations who are not able to satisfy the demand of their clients. Okay, so you can be like an outhouse consultant. Okay, now for this you can charge per session depending on the client, depending on the level of interaction. You can charge, say, between 1,000 to 5,000 Kenya shillings per session, and still make it in that area. Again, in terms of consultancy and self-employment, you can get into corporate mental health training for organizations, non-profit organizations, profit-making organizations, all kinds of organizations where there are people need training on mental health. You can train on workplace stress management, burnout prevention. You can provide various interventions under employee wellness programs, okay? And your clients will be various institutions or organizations, NGOs, international organizations, local organizations, county governments, okay, national governments, all right. For example, training teachers on stress management, okay, especially those who are dealing with young children, all right. Again, still on consultancy and self-employment, You can work in community-based mental health programs. You can run awareness campaigns for communities with communities, anti-stigma programs, mentorship of youths. Like I already shared, that the youth require a lot of mentoring and guidance due to the mental challenges that they are going through. Um, you can get funding because now this will be community based, housed, housed by community, let's say CBOs or NGOs or youth projects. You can get funding from NGOs, and in your proposal you will include your fees from county governments, from donor agencies. All right, you can do digital mental health service provision. You can work online and provide mental health services. You can teach, like train online. You can do online counseling using various available platforms. You can have mental health blogs, podcasts. Okay, there's so much blogs. Okay, right. So just type in the comments, please, for me. Would you yourself feel free or feel comfortable with offering your services online? Okay, so you can just respond yes or no to that. And then still on self-employment and consultancy, you can do research. So you can conduct needs assessments for communities or for organizations. You can evaluate programs. You can do policy research. Okay, for example, evaluating mental health programs in a county. Okay, they can hire you to do that. You can cut a niche on basically doing research and consultancy. Then when it comes to employment, because self-employment is not for everybody, when it comes to employment, we still have gaps in health institutions, in hospitals, like in national hospitals like Kenyatta Hospital, Madari National Hospital, in county hospitals. Of course, you can work as a medical social worker, and at this level, you're looking at moving into managerial positions. All right, so mentoring other medical social workers, other social workers in the medical arena, supervising them, consulting for them or on their behalf. You can work for NGOs and international organizations, for example, UNICEF, WHO, the African Mental Health Foundation. You can work as a program officer, as a mental health consultant, as a community outreach officer. Being employed again, you can work in a learning institution like in schools, in universities. You can be a student counselor. You can be a staff counselor. You can give these institutions, provide wellness programs for them. Again, in terms of employment, you can work for government and policy institutions. You can work in the Ministry of Health. You can work in county governments, and with devolution, a lot of doors are open to be able to do that. And in this case, you can work in policy development. You can do mental health advocacy. You can work in correctional and rehabilitation services, in prison, like in the Kenya Prison Service, in rehabilitation centers, as counseling, deal with counseling offenders, work with the reintegration programs as a mental health expert, okay, a social worker whose area of expertise is mental health, okay. Um, then so there's a lot that you can do. So I've then put here a short case scenario that you can use to jog your mind, on income opportunities. And in this scenario, I'm saying identify rising alcohol abuse among border riders in Kakamega. What can you do? Okay, in other words, what I'm posing is there are so many mental challenges or mental health issues in society. So you can identify some, one, or several, and already begin to think of how to apply intervention. And that can open up doors for even self employment or for stakeholder collaboration with an NGO or a similar organization. So in this case, you first conduct a needs assessment about the issue, you design the intervention program, you partner with a relevant body, let's say an NGO that is uh, focusing on mental health, the county government, and you apply for funding. And the funders like collaborative teams, multidisciplinary teams. Yeah, and in this case, you'll find you're working as a consultant and a program implementer. Okay, so this is just to encourage you to think outside the box and to open up your mind to get away from the feeling that there are no jobs, or jobs are minimal, or opportunities are minimal. But particularly in this area, the needs are so ripe. It's like the biblical phrase, the harvest is plenty, but the harvesters are few. Okay, because the stress levels and the challenges people are going through in society today have heightened, and yet the support systems have weakened over time. Okay, we used to have support systems like the traditional support systems of extended families. Now people no longer stay that much together. We have fewer conversations among those who are related. Modern way of life, the use of technology. There's so many things that have affected the social fiber of society that help to maintain better mental health. Okay. So there's a group activity for us here. So you do this in your groups. Design a simple mental health business idea or consultancy service. This is good for use now in the class, but it's also good for use in building your career as you move on. So take it and keep polishing it even after we are done with the coursework. All right. So, in summary, mental health is a career and income opportunity. You can be self employed, you can be employed, you can be a consultant. All right. So, please just type for me in the comments what is one way that you will be able to use this knowledge to make money or grow in terms of your career. All right. I think we can stop at that. I'm not seeing any questions or comments in the chat. So I think if they do come, you can still follow up with me and call or send them in the WhatsApp. All right. Okay. I wish you a good evening. Enjoy your weekend. Bye.